Hello, I'm Dr. Jim Seeds. I am an orthopedic surgeon for Midwest Bone and Joint Institute, which is based out of here in Elgin. We've been serving the area for over 30 years. I am a board-certified general orthopedic surgeon with a subspecialty and board-certified in sports medicine. Did a fellowship training down in Birmingham, Alabama in orthopedic sports medicine with arthroscopy. Common injuries with strength and sports injuries or physical activity injuries mostly is related to overuse injuries, repetitive, getting into things too quickly, not conditioning prior to, not appropriately conditioning with the activity. Take example, runners who go out, they can run too quickly or too fast and develop shin splints, which are technically strain to the muscle as it attaches to the bone, which can lead to stress fractures. You also have in lifters or repetitive activity, you can get tendonitis, inflammation of the joints, muscle inflammation, irritation. So it's a lot related to the muscles, the bones, or the tendons just not being used to the activity that people are putting upon their ligaments or tendons or muscles. It causes that soreness or that injury. Treatment options for those injuries is typically initially pretty simple. It's stay away from the aggravating cause. And if, again, you take runners, it's stop the running. For shin splints or stress fractures or stress injuries, it's rest it, ice it, elevate it, and again, the activity modification, keep away from the things that aggravate it until that pain or soreness goes away, and then getting back with that activity slowly. A structured, regimented approach at exercising or activity is the best thing. Occasional use of over-the-counter anti-inflammatories, and occasional, I mean just in the initial phases. You never want to use that chronically. Signs and symptoms of serious injury. If you go back to the initial treatments we talked about resting, and icing it and activity modification. If that does not help with the pain or discomfort, then that's something that should be looked at by a professional. Injuries that you can't walk on or you can't use the extremity, severe pain, that's something that also should be checked out. And if it doesn't respond over a couple days or a week or so of resting and still is causing a lot of discomfort where you can't get back to the activity you want to, that's something that should be checked out by a physician. Should you contact your physician before getting into an exercise program? That's smart to contact them if you have a primary care doctor or a physician who is monitoring your health. If you have any health conditions at all, then absolutely you should be checked out before getting into a program, especially runners. That's something that, if you have a medical condition, high blood pressure, or some coronary artery disease, or athletic-induced asthma, sports-induced asthma, that should be checked out by a physician. And then an exercise program like working out, again, if you have health conditions, that should be checked out. And any gym that you join, they usually have structured help there, therapists or trainers that go along with the membership that can show you how to use the exercise equipment. Young people who don't have any medical problems, if you're smart about it, getting into starting out slowly and gradually increase your activity, I think that's appropriate, but anybody with any medical condition should seek their doctor before getting involved in the activity. the diet affect your susceptibility to injury? I believe it can. I mean, a normal, regular diet, or regular, three meals a day and a balanced diet, it shouldn't be a problem. But if you're eating fast food all the time and don't have a balanced diet, then yes, that could contribute because you're not getting the vitamins or the proteins or the appropriate balance of carbohydrates, fats, and proteins. So it can contribute, yes. Yeah, exercise and muscle strengthening definitely helps out in your overall well-being, your self-perception, a higher accomplishment or thought process of accomplishment, not to mention your health status as far as your lung capacity, your endurance, your physical strength. Definitely strong muscles around joints helps prevent arthritis and helps patients deal with their arthritis. A lot of times I see patients for arthritis or any type of joint injury, therapy is a big part of their recovery, and therapy involves building good muscle strength around those joints to help stabilize those joints and take pressure off those joints. So there's a huge benefit from physical activity and exercise. How does physical exercise or strengthening build muscle? It increases the size of the muscle, and depending on what you're doing, whether it's strength training, you're increasing the size, or running, running more so builds endurance for the muscle. And with any type of program or exercise program, what you're doing is educating that muscle. You're training that muscle, so you're getting a better blood supply to the muscle. The muscle is teaching itself how to keep up, more or less, meaning a better factory or work environment for that muscle to function in. Specifically, mitochondria, which is the powerhouse cell for the cell, helps the muscle be able to keep up. So the blood supply, the nerve response to the muscle is enhanced, meaning it gets better function out of the muscle as well as better strength. And you get better strength by increasing the size of the muscle. So there's a lot of processes involved, not only the muscle getting bigger, but blood supply, then the nerve supply, all that enhances building a better response and a better conditioning of the muscle.